Have you ever heard about thrombosis? It may sound like a complicated medical term, something distant, something that only happens to other people, but the truth is, thrombosis can happen silently, and it can happen to anyone. Imagine your bloodstream as a highway where millions of cars, red blood cells, travel every second. Now picture a traffic jam forming suddenly, blocking the path, causing chaos behind it. That's exactly what thrombosis does inside the human body. A blood clot develops, blocking normal circulation, and when this happens, the consequences can be serious. This is why understanding the signs, the causes, and the available treatments is so important. In this video, we are going to uncover everything you need to know about thrombosis, the early signals your body might give you, the main reasons why it happens, and how it can be treated. And I want you to stay with me until the very end because the knowledge you gain today might one day protect you or someone you love. Awareness can truly save lives, and sometimes it begins with simply recognizing symptoms that most people would ignore. So let's start from the beginning. What is thrombosis, really? At its core, thrombosis is the formation of a blood clot inside a vein or an artery. This clot can partially or completely block the blood flow. When blood is flowing freely, oxygen and nutrients are carried to every part of the body. But when circulation is blocked, those areas are starved of oxygen, and damage begins quickly. The danger is not only in the blocked area itself. A clot can also break free and travel to vital organs such as the lungs, heart, or brain. That's when it becomes truly life-threatening. But thrombosis is often silent. It doesn't always announce itself dramatically. Many people dismiss its early signals as something minor, a bit of swelling in the leg, a sensation of heaviness, maybe some discomfort after a long day. But those seemingly small signs might be your body's way of sounding the alarm. The problem is, many people ignore them until it's too late. That's why understanding and listening to your body is absolutely crucial. One of the most common types of thrombosis is deep vein thrombosis, often called DVT. This happens when a blood clot forms in the deep veins, usually in the legs. The signs can include swelling, pain, redness, or warmth in the affected area. But here's the tricky part, not everyone experiences strong or obvious symptoms. Some people barely feel anything at all until the situation becomes dangerous. That's what makes DVT so deceptive. Imagine this scenario: someone takes a long flight, sitting still for hours, not moving much. After landing, their leg feels a little swollen, a bit sore. They brush it off, thinking it's just stiffness from travel. But inside, a clot may have formed. Days later, that clot could break free and travel to the lungs, causing what's known as a pulmonary embolism, a potentially life-threatening complication. And it all began with a small, easily ignored symptom. So what should you look out for? One of the most telling signs is swelling in just one leg, particularly if it comes on suddenly. Unlike the general tiredness we all feel sometimes, this swelling doesn't go away easily. Another clue is pain or tenderness that gets worse when you walk or stand. Redness or a feeling of warmth in the skin over the area can also be a warning. Some people even describe a sensation of heaviness, as if the leg just doesn't feel normal. Each of these signs might not seem serious on their own, but together, they paint a picture that shouldn't be ignored. But thrombosis doesn't stop at the legs. Clots can form in other places too. For example, clots in arteries of the heart can lead to chest pain and serious complications. Clots in veins of the brain can trigger headaches or vision problems. Wherever the clot forms, the message is clear: your circulation is being interrupted, and that is something you cannot overlook. Now, you might be wondering, why does thrombosis happen in the first place? Why would the body, which depends so much on blood flow, allow clots to form? The answer is that blood clotting is actually a natural, protective process. When you cut your skin, clotting prevents you from bleeding endlessly. It's a defense mechanism. But sometimes, the body creates clots when they are not needed. This can be triggered by many factors: sitting still for long periods, certain health conditions, dehydration, smoking, genetic predispositions, and even some medications. When these factors combine, the risk of thrombosis rises sharply. Think of it this way: blood is meant to move. The moment it stays still for too long, or the vessels carrying it become damaged, clots are more likely to form. It's like water in a river. As long as it flows, it stays clear. But if it stagnates, it begins to accumulate debris, and soon, it's no longer healthy. The bloodstream works in a very similar way. Here's another important point: thrombosis doesn't only affect the elderly. Many people associate blood clots with age, but younger individuals can also develop them, especially if they are exposed to risk factors like long immobility, unhealthy lifestyle habits, or underlying health conditions. That's why it's so important not to assume, "This can't happen to me." Awareness is key for everyone. And now let's return to the signals your body gives. The challenge is that thrombosis is sneaky. It can develop slowly, almost invisibly. That's why, throughout this video, I want you to keep one thing in mind: never dismiss unusual changes in your body. If your leg swells without explanation, if you feel pain that is out of the ordinary, if your skin changes color or warmth in a specific spot, take it seriously. Listening to your body could make the difference between a small clot that's treated in time and a severe complication. In the next part of this video, we'll go deeper into the causes of thrombosis, the risk factors that make some people more vulnerable, and how lifestyle choices can influence the likelihood of developing clots. You'll see that while thrombosis can seem unpredictable, there are patterns and triggers you can recognize and, in many cases, avoid. Stay with me, because understanding these causes will help you protect yourself and your loved ones from one of the most silent but dangerous threats to your health. Now that you understand the early signs of thrombosis, it's time to explore why it happens, the causes and risk factors that make some people more vulnerable than others. Understanding these factors is essential, because it empowers you to take control and prevent serious complications before they occur. Blood clotting is a natural process. Your body creates clots to stop bleeding when you are injured, which is vital for survival. But sometimes, clots form when they are not needed, inside veins or arteries where blood flow should remain smooth and uninterrupted. This happens due to a combination of factors that increase your risk, and these factors are more common than most people realize. One of the main contributors to thrombosis is immobility. Think about situations where your body remains still for long periods, long flights, extended car rides, hospital stays, or even sitting at a desk for hours without moving. When blood doesn't circulate effectively, it can pool in the lower extremities, giving clots the perfect opportunity to form. This is why doctors emphasize movement, even small stretches or short walks, during prolonged sitting. Your bloodstream literally needs motion to stay healthy. Another major cause is damage to the blood vessels. When the inner lining of a vein or artery is injured, the body responds by creating a clot to repair it. This can happen due to surgery, trauma, or certain medical procedures. Even something as simple as minor inflammation in the veins can increase the likelihood of clot formation. Over time, repeated injuries or chronic inflammation can make the risk much higher. Certain health conditions also play a significant role. Obesity, diabetes, high blood pressure, and cardiovascular diseases all contribute to a higher risk of thrombosis. These conditions can affect circulation, increase inflammation, and alter the balance of clotting factors in the blood. For instance, people with diabetes may experience changes in blood flow that make clots more likely to develop. Similarly, high cholesterol can damage the walls of arteries, creating another pathway for clot formation. Smoking is another critical factor. Nicotine and other chemicals in cigarettes damage blood vessels and increase the stickiness of platelets, which are the cells responsible for clotting. Smokers have a much higher risk of developing thrombosis compared to non-smokers, and the risk rises further when combined with other factors like immobility or existing health conditions. Age also matters. While younger individuals can develop thrombosis, the risk increases significantly after the age of 40. As the body ages, blood vessels naturally become less flexible, circulation can slow down, and the likelihood of clot formation rises. Hormonal changes, particularly in women during pregnancy or when using certain contraceptives, can also influence clotting risk. Estrogen, for example, can increase the likelihood of developing thrombosis, which is why doctors carefully monitor women on hormonal therapies. Genetics cannot be ignored either. Some people inherit conditions that make their blood more prone to clotting. These genetic predispositions may remain hidden until a trigger, like immobility or surgery, activates the clotting process. Knowing your family history and discussing it with a doctor can be a crucial step in prevention. Dehydration is another subtle but powerful risk factor. When the body lacks enough fluids, the blood becomes thicker, making it easier for clots to form. Staying hydrated may seem simple, but it's a foundational step in maintaining proper circulation and preventing unnecessary clotting. Lifestyle factors matter greatly. Sedentary habits, poor diet, excessive alcohol consumption, and stress all contribute to increased risk. Eating foods high in unhealthy fats can damage arteries and reduce circulation, while sedentary behavior allows blood to pool in the veins. Stress triggers hormones that can influence clotting mechanisms as well. Each small lifestyle choice adds up over time, influencing the likelihood of developing thrombosis. It's important to note that these factors rarely work in isolation. Thrombosis is often the result of multiple causes interacting together. For example, a long flight combined with dehydration, a history of obesity, and a genetic predisposition creates a perfect storm for clot formation. That's why prevention requires a comprehensive approach, understanding all the risk factors and addressing them proactively. Now, think about the people in your life. Many of them may unknowingly be at risk because they haven't moved enough, haven't hydrated properly, or have underlying conditions they ignore. That's why spreading awareness about the causes of thrombosis is just as important as recognizing the symptoms. Knowledge empowers action, and action saves lives. In the next chapter, we'll explore treatment options, medical interventions, and lifestyle changes that can reduce the risk of complications. You'll learn how doctors approach thrombosis, what can be done if a clot develops, and the steps you can take to protect yourself every day. Stay with me, because understanding prevention and treatment is the final piece of the puzzle, and it could literally change the outcome for you or someone you love. Now that we've explored the signs and causes of thrombosis, it's time to talk about what can be done, the treatments, interventions, and lifestyle measures that can make a real difference. Understanding this is crucial because thrombosis is serious, but it is also manageable when detected early and treated properly. Knowledge combined with action is your best defense. When a blood clot is diagnosed, the first priority is to prevent it from growing and reduce the risk of it traveling to vital organs. Doctors often use medications called anticoagulants, which are commonly referred to as blood thinners. These medications don't dissolve the clot immediately, but they prevent new clots from forming and allow the body's natural processes to break down the existing clot over time. In many cases, anticoagulants are highly effective, but they require careful monitoring to ensure proper dosing and minimize risks. In some situations, more aggressive interventions may be necessary. For example, in cases of severe thrombosis or when clots threaten critical areas like the lungs or brain, doctors may use procedures to physically remove the clot. This can involve specialized catheters, surgical procedures, or devices designed to break up or extract the clot. These interventions are not common for everyone, but they exist for those rare but high-risk cases. The key takeaway is that modern medicine has multiple tools to manage thrombosis effectively, but early detection makes all the difference. Beyond medical treatment, lifestyle adjustments are equally essential. The first step is movement. Simple activities like walking, stretching, or even standing up every hour can keep blood flowing and reduce the risk of clot formation. For those who sit for long periods due to work, travel, or other commitments, periodic leg exercises or short walks can be life-saving. Remember, thrombosis often begins silently, so consistent movement is a preventive strategy that protects you before any problem even develops. Hydration is another critical factor. Drinking enough water each day helps keep the blood thin and flowing smoothly. Dehydration may seem minor, but it significantly increases the risk of clot formation, especially in combination with immobility or other risk factors. Staying hydrated is one of the simplest yet most effective habits you can adopt. Nutrition also plays a vital role. Diets rich in fruits, vegetables, whole grains, and lean protein support healthy circulation, reduce inflammation, and help maintain optimal blood pressure and cholesterol levels. Conversely, excessive processed foods, sugar, and saturated fats can contribute to vascular damage, slower circulation, and higher risk of thrombosis. Every healthy meal is a step toward stronger blood vessels and a lower chance of clots forming. Smoking cessation cannot be overstated. The chemicals in cigarettes damage blood vessels, increase clotting tendencies, and elevate overall cardiovascular risk. Quitting smoking not only reduces your risk of thrombosis but also improves overall heart and lung health. For anyone who smokes, this is one of the most powerful preventive measures available. Regular checkups are also essential. Even if you feel fine, routine medical examinations allow doctors to detect subtle changes in circulation, blood clotting factors, and overall cardiovascular health. Early detection gives you more options and increases the likelihood of positive outcomes. Don't wait for symptoms to appear. Prevention is always more effective than treatment after the fact. Another important aspect is awareness of risk factors in daily life. If you have a personal or family history of thrombosis, hormonal therapy, or chronic conditions like diabetes or high blood pressure, discussing these with your doctor helps tailor preventive strategies to your needs. You can't always control every risk factor, but you can take proactive steps to reduce your overall vulnerability. It's also worth emphasizing the emotional component of prevention. Many people feel anxious after learning about thrombosis, but channeling that concern into informed action is what truly protects you. Taking daily steps, making small adjustments, and staying consistent with checkups transforms fear into empowerment. Think about the people you care about. Your family, your friends, your colleagues. By protecting your own health, you also reduce the risk of sudden emergencies that impact everyone around you. Prevention doesn't only benefit you, it safeguards the people who rely on you. That's why spreading awareness, sharing information, and encouraging healthy habits in your community is just as important as personal action. Now, let's recap the most crucial points. Thrombosis can be silent, but its signs include swelling, pain, redness, and warmth in the affected area. Causes range from immobility and vessel damage to genetics, lifestyle, and chronic conditions. Treatments like anticoagulants and medical procedures are highly effective, especially when combined with lifestyle changes such as regular movement, hydration, healthy eating, smoking cessation, and routine checkups. Prevention is not just possible, it's within your control. The ultimate message is clear: don't ignore your body. Don't assume that small changes are insignificant. Pay attention, stay informed, and act quickly if something seems unusual. Your life may depend on the awareness you have today. Knowledge without action is useless, but knowledge with action is life-saving. And before you leave, remember this: share this video with someone you care about. You never know who might recognize a symptom or understand a risk because of the information you provide. Awareness spreads protection, and prevention can save lives. Take control of your health now, stay vigilant, and make choices every day that strengthen your body and your future. Your health is your most valuable asset. Treat it with the attention it deserves, and don't wait for warning signs to become emergencies. Thrombosis is serious, but with knowledge, prevention, and action, you can protect yourself and live with confidence, knowing you are doing everything possible to stay safe.